Okay, hi everybody. Welcome to week 2. I hope you guys enjoyed week 1. We're going to be continuing along the same sort of ideas. I've got our plan for today laid out here. We're going to start off by reviewing last week's, 2 weeks ago's material. Just spending a few minutes going over it. It's kind of nice to be able to have these lectures up on YouTube. I hope that's been a useful resource. I see that's been seen a decent number of times now. So I don't know whether those are 5-minute views or whether people are sticking around, but I hope that's been useful. We're going to spend some time talking about the Western medical theory versus Chinese medicine theory, oftentimes diving right into the Chinese medical theory without some time spent on the Western side leaves it without a lot of context. So there's the Chinese medicine part of the philosophy, the Western medicine part, but the most interesting part is the delta, the space in between them. So we're going to spend some time with that. We're going to talk about heuristic systems, which is what a lot of Chinese medicine uses. We're going to begin touching some pathogen models, which we'll explore later on in the semester. We're going to talk a little bit about root and branch. I'm going to hopefully give a good explanation for what people mean when they say to you, "it depends," as the answer to a question, which some of you have probably heard a couple times already. And then we're going to go over some of the classical metaphors used. So looking at the body as a walled city, we're going to spend a minute looking at the 5 elements again. We're going to talk a little bit about different archetypes within Chinese medicine that the different organs can represent. I really like psycho-emotional cases, and for all of those, this sort of approach is very useful. And then we're going to start talking about external disease, which will lead us into next week. Again, no quiz. We're just going to roll this particular quiz over into the midterm. You were going to do it a second time in the midterm anyways, but there's really almost no way to functionally create a Moodle exam with something like 60 fill in the blank boxes. So we're just moving on that one, but there will be a multiple choice quiz up for next week. I'm not the biggest fan of multiple choice, but that's what we're working with. Before we start, anyone have any questions?
Yeah, Peter, the quiz
Sure.
next week is week 1. This is week 3. I'm assuming you're just saying week 2 because no classes last week?
Yeah, so this is the week 2 material.
Gotcha.
So if you go on Moodle, I've submitted a support ticket to have them readjust the weeks. But currently, if you're looking at the syllabus or you're looking at Moodle, it's week 2 of this class, despite the fact that it's week 3. Does that make sense?
Yep, so the quiz next week is week 1 in this week's material. And,
yes,
in today's material.
We can talk about the quiz for a minute at the end of the class today. It's not going to be, it'll be, everything is in the slides.
Okay.
I actually haven't reviewed the quiz myself.
No problem.
But yeah, this is not a challenge. That's the wrong quiz. Yeah, it's just on external disease. So I'm just going to want you guys. We'll talk about it at the end of class. It'll be pretty straightforward.
Okay. Cool.
Yep.
Thanks.
Yeah. Sorry, was that Veronica? Did you have a question?
Yeah, I was wondering, is there a portion of the syllabus that breaks down the what we'll be going over week by week anywhere? Because I know on Moodle, it's just like the page that's, I guess, pertains to all classes.
On the Moodle, there should be, when I look at the Moodle, what I see is a breakdown similar to this on each week. Do you guys not see that?
I do. I see it.
Oh, okay.
Okay, yeah, that's what we're currently going to be working with, though again, it's a week off, but that should be adjusted. Normally in person, all of these things are a lot easier to just change on the fly, but it's a little more complicated here. Okay, so no quiz today. Let's do a little bit of a recap. So a lot of last week was trying to lay some of the foundations, some of the ground floor of what we're going to be talking about really for the rest of your education. A lot of the times, the way that you're going to be taught, a lot of the times the way that you're going to be taught Chinese medicine is as an if-then kind of disorder-based way of treating. So you're going to hear like, oh, if a patient has asthma and it's dampness in the lungs type asthma, then these are the acupuncture points you're going to use. And I think it's important that we bring in the fact that underlying that, okay, thank you, Julia. Underlying that, we've got yin and yang and the 5 phases or elements making up the philosophical ground floor. That's where we're getting all of our ideas from. Everything has been built on top of that. Hopefully that lecture last week stuck with you guys and it's still making sense, but that's most of it. We also have an interesting thing around translation. I want to spend just a minute on this. So there's a debate within the more academic circles of Chinese medicine that you may begin hearing in your 3rd or 4th year about whether or not, how much we should be translating. You'll encounter some professors who believe that you really probably should learn classical Mandarin, how to read classical Mandarin decently well to have a good understanding. And there are other people who think that we should really create westernized terms for everything. And both sides have good points that they're making. It's certainly a high bar to demand like a master's degree education in classical Mandarin before you even start Chinese medical school. It's a little unfair, and certainly not a bar that I've reached. But there is a lot that does get lost in translation. The 5 elements versus the 5 phases is a good example. Simultaneously kind of a small thing, yet important philosophical distinction. And the video is, of course, available online for review. It's really nice to have that. Okay, so let's talk about heuristics. This is a lot of what we're doing within Chinese medicine. So you're going to encounter questions like, is Chinese medicine real, or is Chinese medicine true, or is Chinese medicine factual? And when we say liver fire, we don't literally mean that the liver's on fire. What we're talking about is a way of discussing and categorizing systems of the body that leads us to an effective solution. And that's kind of what a heuristic is. Any approach to problem solving that employs a practical method, not guaranteed to be optimal, perfect, or even rational, but instead sufficient for reaching a goal when finding an optimal solution is impossible or impractical. Western medicine uses a ton of heuristics as well. All problem solving uses it because you can't really get to a perfect answer for anything. So the question is, when your patient comes in to see you, how do we get from them having a problem to being able to do something to improve it in an efficient, effective way? So pull up. So the idea is that we simultaneously want to optimize for speed, accuracy, and efficacy, right? This is where we want to live when working with patients. We could get way more accurate by spending a lot more time. We could increase our efficiency if we lose accuracy, but what we want is the optimized version of all 3 of these. How you choose to practice is going to change the balance of these. For example, people doing community acupuncture tend to be much more interested in the speed side of things than they are in the accuracy or efficiency side. And people who are doing 5-element acupuncture tend to be much more over on the accuracy side, at least from their perspective. So you're going to optimize in different ways depending on how you want to work, but ultimately you have to make decisions. If this is doubly so in community acupuncture, for example, some of the reasons that they're making the decisions they're making are to reduce the cost for the people who are coming to them. If you want to treat people who don't have much money, the only way that you can do that and still have it a profitable business is to treat a lot of them, right? Does that make sense? So how does this work for us specifically? We need a problem to solve, first off. We're trying to get an improvement in health. Whether or not the heuristic is functioning is whether or not it solves the problem, not whether or not the process of getting there checks all the right boxes. We judge the heuristic model by its results. If we want to understand health, we have to understand disease. If we want to understand disease, we have to understand health. At first, it seems really intuitive to say, oh, we're here to make people feel better. We're here to reduce disease. We're here to get people out of pain. But the actual nuts and bolts of that is a lot more complicated than it sounds like. And to begin looking at how we view all of that in Chinese medicine, we're going to have to talk about how it looks within Western medicine as well. This David Foster Wallace quote is one of the ways that I like to describe this. Most of us have grown up within a Western culture, within a culture based upon Enlightenment traditions, on a Judeo-Christian worldview, and in a scientific materialist sort of a setting. Because of that, we're now partially stepping out of that worldview to discuss Chinese medicine, and to do so, we have to first look at where we're starting. So there are these two young fish swimming along, and they happen to meet an older fish swimming the other way, who nods at them and says, "Morning, boys, how's the water?" And the two young fish swim on for a bit, and then eventually one of them looks over at the other and goes, "What the hell is water?" So I would contend that we have been swimming in a sea, lost you guys here. Okay, we've been swimming in a sea of Western medical thought, and we're gonna have to start looking at what that is to be able to move forward. Guys with me? Okay. Even if you personally feel like this doesn't really apply to you, it's gonna apply to your patients. So when you're thinking about, if you're thinking to yourself, look, I've been meditating on a mountain for 10 years already. I'm not within this Western medical materialist perspective. Well, your patients will be, which means that you're going to have to understand how to communicate with them. If you can't speak the language that they're used to, it's going to be very hard to communicate to them a different way of thinking. So, what is health and what is disease? I think this is the best example of how Western medicine sees this equation. The enemy is death, and the physician's job is to hold it at bay. And since the enemy is death, the focus of Western medicine is death. In fact, if we look at the history of Western medicine in the past couple hundred years, most of the advances within it came during war. Battlefield medicine has always been a central piece of Western medicine, or at least its advances in the past couple hundred years. Surgeons used to be judged in large part on how quickly they could amputate an injured limb from a person. These are concepts that we see within Chinese medicine as well, but they don't take a central place in the same sort of a way. So if your problem is that you might die, especially acutely, I strongly recommend you go to a Western medicine physician, because this is what they do as their central piece. If your interest is something else, they may not have looked at that as closely. Also, this is on the side of a public health building, I believe in Indiana. It's a huge, like, offset relief. It's pretty cool. There's another one on the same building with a somewhat similar idea. So because Western medicine is focusing on prevention of death, which is easy to define. It's easy to define death. Death is the lack of life. We can see it in a number of different ways. Heart stops beating, person stops breathing. We can look at brain function now. I mean, there's arguments around edge cases of like vegetative states, but people aren't particularly confused about what death is. On the other hand, we don't have a good definition of what health is. Western medicine doesn't talk about that. Are your ranges normal? Are you currently moving towards death in a way that's apparent? If so, you're fine. If that's not happening, you're fine. But when it comes to health, this is one of the reasons why culturally we have so many different diets show up, cleanses show up. Try this to improve your health. Try this to improve your health. We don't have an idea. You would be hard pressed to find someone who would say, I'm healthy, and mean that across the board. There's always things that could be optimized and improved because we don't actually know what we're going for here. It can be a journey that goes endlessly, even if every step succeeds. Does that make sense? We got a question here. When you say we don't have a good idea of health, do you mean TCM practitioners or people in general or Western medicine? I mean Western medicine. A lot of TCM practitioners haven't really explored this, but it's something that is very much in our literature, and we're going to be talking about it in this class quite a bit. Slightly skipping ahead, Western medicine is about not having disease. Chinese medicine is about not having disease and then getting better than that, right? There are lots of things that we see as treatable conditions that within a Western medical framework are subclinical, meaning they just don't really count yet. That make sense, Lindsay?
Yeah.
Great. Okay. So within disease, we've got all of these binary yes or no questions. A person either has the antibodies, a person either has a disease or doesn't in many cases. So we're looking at this with COVID right now. There's no, you only kind of half have COVID. You either got the disease, we can test it. Tests aren't always accurate, but we're not going to talk about that. You're tested for it, you either have it or you don't. It's a binary. You either have diabetes or you don't. And then we get the fuzzy area of pre-diabetic, but that doesn't really count either. You're either diabetic or you're not. But in reality, there's a huge gray area here. This is doubly true. There are lots of areas of Western medicine where this is very obvious, such as depression. When does depression become a disease? It's usually measured by persistent negative emotions for 2 or more weeks. That's an from a Chinese medical perspective, we don't, we'll get to that in a second. Let me answer you in just 1 second, Lindsay. So this gray area within Western medicine is often defined by boundaries that move over time. So we can look at something like the body mass index, which changes somewhat frequently in terms of what's important. We can even look at this for lab tests, something like a GGT test that used to be a 0 to 30, I don't remember the units, 0 to 30 being the range, and now we're caring much more if it's above 20. The definitions of the gray areas change. If you talk to a naturopath, they'll often say like, sure, this is within the standard range in a hospital, but for us, we see this as on the high end of standard, and then that's something that we care about. All of this is, where's the diagnosis? How do we work with that? Chinese medicine, we live in the gray area, and it works very well for us. We'll get to that a little bit in a second. Lindsay, also I've read a lot about how TCM has been used to treat acute conditions. Would you disagree based on your statement about if you're going to die and acutely, Western medicine is the way to go? I'm going to try to answer this quickly. Chinese medicine has a lot of great options for serious, life-threatening acute conditions. We should not use them. This is a Western medical referral situation. There's lots we can do, and if you look at a lot of what's being done in China, Chinese medicine does use these techniques, but they use them in a hospital where someone could say, go into surgery quickly. So an example of this is we have an herb that you're going to learn in Herbology 1. I've already learned Intro to Herbology called Gansui. I think you learn Gansui, you might learn Bado, somewhat similar herbs. They're both used to treat ascites, life-threatening condition. Person is likely to die imminently. Both of those herbs might also kill the person. They can be used in a situation within a hospital where the person could be taken to surgery if they need to be, but using them on their own, it's probably better to just call 911. We have techniques. I've found myself in a number of weird situations with people with severe acute conditions going on. I usually take them to the hospital. Physical injury and trauma, sometimes there's a lot we can do. We can often work alongside people, but yeah, just, I mean, doubly so for legal reasons within the US if you're gonna get sued out of your practice if you try to do any of that. And there aren't a lot of people to teach you it because it's not something that's being maintained in the same way, right? Were I to want to begin doing acute life-threatening Chinese medicine, I'd really want to study under someone for something like 10 years who's doing that all the time, and that's not available, as far as I know. Okay. So let's talk about the gray area. I'm saying this is where Chinese medicine lives, and I personally think that this is where we should be trying to make inroads within the Western medical establishment in general. But let's try to define it a little bit. Hard to define within Western medicine, not hard to define within Chinese medicine. But we're going to start with the Western side. So the gray area is anything that gets turfed off to the psych people. Anything counted as psychosomatic falls into the gray area, right? Anything related to complicated endocrine disorders tends to end up in the gray area. It's like, well, a bunch of things are off. We just don't really know. These are the people who get bounced between a bunch of different specialists. Anything that's patchable, that's frequently treated with things that can't be cured and instead are managed for very long periods of time. We can't fix all of those, but there's some of them that we can. So for example, ADD would fall into this category. It's patchable. We can give you something that removes the symptoms, but complicated endocrine issues. So endocrine issues where a lot of things are simultaneously out of whack in multiple systems and we can't find a central cause within Western medicine. Yeah. Hashimoto's may or may not count 5 things at the same time. People start to get a little lost there, and fair enough. A lot of psychoactive compounds, stimulants, polycystic ovarian syndrome can be, we are good at treating polycystic ovarian syndrome. I worked in the Mediterranean for a little while. We're pretty good at it. Just acupuncture, watching cysts go away. It's pretty cool. Okay. So the gray area is everything that Western medicine's not good at treating, but also not good at acknowledging the existence of. So depression's a big issue, but how do we even go about studying it? I use the example of anxiety, which is defined by different people differently. So when I have patients that come to me and say, oh, I've been diagnosed with anxiety, my first set of questions is to figure out what they're actually talking about. Because one person's anxiety is another person's heartburn, is another person's depression, is another person's agoraphobia, is another person's insomnia, is another person's gluten intolerance. We got to work through what it is that they're actually saying they have, because within the Western medical context, anxiety means negative emotions of a, let's say, kind of excess manner, whereas depression tends to be negative emotions of a kind of deficient manner. And within Chinese medicine, both of those are 50 different diagnoses. The other thing that we see a lot of this is, one of the signs that you're in the gray area is the word syndrome being attached to anything. Metabolic syndrome, polycystic ovarian syndrome. It's like, we know there's a genetic component, and that's kind of the end of the conversation we have. And then we see the symptoms arise, and there's something endocrine there, and we can measure some of it, but we don't know why. But it's definitely, there's some genetic stuff. As soon as it's genetics, it's a little over here. We'll get to that. We're mapping that. We'll get there. But for now, it's hard, right? So the definition of a syndrome is a group of symptoms which consistently occur together or a condition characterized by a set of associated symptoms. I translate that as, we know it's a thing, but we don't know why. IBS, 100%. So a lot of syndromes can sometimes be treated, but when they can't be treated, often there's no more recourse. So some people with irritable bowel syndrome go to a Western medical establishment doctor. They go through a number of different things, and some of them get great results. If they don't get great results, the set of options runs out very quickly for what can be done. Because it's like, here's the syndrome. Here are the 5 things we know sometimes work. We don't know why, but we know they sometimes work. And if we use them up, we're getting into like exploratory surgery territory. We're getting into psych referral territory. Maybe it's just in your head. In Chinese medicine, we don't have a separation between the head and the body. It's the same thing. There is no mental versus physical. It's the same thing. We'll get into that later. Yeah, chronic fatigue syndrome is one of my favorites. Like within Western medicine, it's like, you're tired. You say you're tired. We can't measure your tiredness. You're reporting it. Are you lazy? Are you low energy? Do you have adrenal fatigue, which is poorly defined and is kind of a thing and kind of not? So there's a lot of problematic experiences that people have that negatively impact their life, that the Western medical establishment, because of the tools that they have and the philosophy through which they look, can't see or diagnose. It's not that they're bad people. It's not that they're not trying their best. It's that the lens that they're looking at the world through doesn't allow them to see these things. We have these problems too, we just have a different set of them. So they work together nicely, but integration's hard. We'll get to that. Allison, in those cases, how much work do TCM practitioners have to do just for damage control from what Western medicine has prescribed done to that condition? Sure depends. Oftentimes, I mean, the gray area is huge. These places where the overlap between what Western medicine's bad at and what we're good at, there's a ton of things there. A lot of them. And sometimes Western medicine has done a lot of damage, attempting, with the best intentions, attempting to solve the problem. And sometimes what they've done has made it somewhat better or is managing it long-term with negative side effects. I have zero interest in demonizing anything within the Western medical system. I think it's a lot of people trying their best to do the most good they can. There's some places where the tool set that they're working with is not correct for the problems that they're looking at, for the suffering that they're looking at maybe. And that's because this is kind of how, a little bit simplified, this is getting better. This would have been very true 30 years ago, and now it's mostly true with some improvements. That's because Western medicine's looking at this through a lens of mechanistic reductionism, which means we want to find the one thing that's the problem and change that. For the people who've read the book, Between Heaven and Earth, this is the discussion that they have of Western medicine looking more like a mechanic and Chinese medicine looking more like a gardener, where if we see scales on the leaves of a plant in a garden, the answer might be in the soil. And if the brakes in your car aren't working, we replace the brakes. So in this case, the more we can remove complexity, the better. We want one diagnosis, maybe two, and then we want one pill for each of those. That's the goal. That's the ideal. The more complexity there is, the worse this works. So for people who watched the show House, which is based on a woman named Lisa Sanders, there's a reason that these people who can handle complex cases are lifted up within Western medicine, because it's nearly impossible to do. The amount of reading you have to have done, the amount of understanding you have to have of the body, it's massive. It's also almost impossible to study. The goal in a Western medical study, in a double-blind placebo-controlled study, is to isolate one variable. So ideally, you're not doing a test on the population, you're doing a test on Polish women between 20 and 35 with a certain condition and a history that looks the same, so we can isolate everything. In fact, this is a problem that we have with a number of Western medical drugs. They were tested on the same sort of cohorts. And then they don't end up working on people of Asian or African or South American descent, because that's not the population that was studied. And it turns out that people with different genetics respond differently to things. And the more complexity you have, the more complexity you have. It's a positive feedback loop. One of the issues here is drugs aren't studied together. Maybe we can study 2 drugs. We can't study the interactions of 30 drugs. This all makes sense? This familiar to people? Okay, good. And what this leaves us with is that health in Western medicine is more or less defined as there aren't any diagnoses. If we can't diagnose you with something, you're healthy. That's kind of what we've got. If the issues are purely subjective, like, I don't know, I just don't feel right, you get referred out. Psychiatrist, psychologist, problem resolved, moving on. And the last version of health is when the patient has no complaints. That one's a little bit sticky. This is a phrase that you're going to hear over and over and over and over again in your practice. Just 1 second, Jasmine, I'll get to your question. Your patients are going to say to you, I thought that was normal, very often. The place you're going to see this the most frequently is with menstrual cycles, where crippling pain for 3 days is fairly normalized. The Chinese medicine version of a good menstrual cycle is 1 hour of mild discomfort. That's what it should look like per cycle, total. Anything more than that, we want to treat, because underlying that, there are other things that are manifesting in other places in the person's body. We use female menstrual cycles as a diagnostic tool for what's going on in their entire system. It makes them easier to treat than men, actually. Western medicine doesn't have this tool set, which means suck it up. Your periods are supposed to hurt. It's part of life. You'd better get used to it. And the interesting thing is, you're cured once they do that within their perspective, because you no longer have a complaint. This is normal. The problem is that I need to adjust to it. Does this sound familiar to anybody? Make sense? If this isn't making sense, please ask a question. So oftentimes your patients will show up and say, yeah, I'm here for headaches, but otherwise I'm healthy. And as you ask them questions, their digestion is poor, they have frequent diarrhea, they have insomnia, they're sleeping 6 hours a night, they have constant low back pain, their knees ache, your list goes on, and they need a nap in the early afternoon. They're like, well, yeah, but that's normal. And within our medicine, not a single piece of that should have been normalized in the first place, but none of it's really treatable within Western medicine. So there's sleeping pills. Yeah, my insomnia is not bad enough, so it doesn't really count. There's pain pills for the low back. Yeah, but those are bad. I don't want to take those. So I guess my low back, it's a thing, you know. In Chinese medicine, every single one of those things is important. But because your patients will generally have been brought up within a Western medical system, they're often not gonna notice those problems. They will have normalized and forgotten about them. Low back pain, that's an issue for the massage therapist that I go to. And within our medicine, that might be early kidney qi deficiency that we can sort out before they end up getting problems down the road. Jasmine, what's your question?
I was just curious because you were saying in Chinese medicine, well, I think that's what you were saying, I got a little distracted, that there wasn't pre-diabetic. It's either you are or you're not. You're either this or you're not. So how do they measure that then? Because in the Western, they do it by like A1C and all that.
Yes.
And if you're below a range, then you're pre-diabetic. But
Yes.
in Chinese medicine, they base it off of not that.
So I was talking about Western medicine with like, you're either diabetic or you're not. And then there's the fuzzy area of pre-diabetic, where what causes you to be diagnosed as pre-diabetic has been changing every few years for the past 20 years, right? Within Chinese medicine, this is getting a little bit ahead of us, but if you just look at type 2 diabetes, forget type 1 diabetes, like type 1 being the one you're born with, type 2 being the one that we usually think about when we talk about diabetes. We have 3 types of type 2 diabetes in Chinese medicine. And they present differently. And we can often, and we don't call it diabetes, we call it, I mean, we colloquially do, but we also call it wasting and thirsting disorder. And often it shows up before the HbA1c shows anything. So our goal is to find the person who's, it's too much for me to go into those distinctions right now because we need more foundation first. We'll talk about that when we get to the yin organs a little bit, but we have a completely different perspective on it. The HbA1c is useful for us, but similar to anemia, like anemia is a really easy place to talk about this. So if we're talking about anemia, Western medicine anemia, and Chinese medicine blood deficiency, there's overlap. There's a bunch of overlap. Often they're the same thing. Often they're not. Part of this is because, as we talked about in the last class, we have a different definition of what blood is in the first place, right? So if someone comes in and they have the symptoms of anemia and we see it on their pulse and on their tongue, but they say, I went to the doctor and I don't have anemia, we don't care. And at the same time, if their blood looks great in every single way that we can look at it within Chinese medicine, and they say, my doctor says that I have anemia, we probably don't care about that either. We're probably going to diagnose it as something else and treat it differently. It might be Qi deficiency, for example, which often has a lot of overlap. Easy to tell the difference, but some overlap. That make sense?
Peter, I wanted to just go back to your point that you were making before.
Sure.
About complaints and how we often kind of, well, I mean, the example that I was thinking of my sister, she was telling me like last week that her feet are always dry, no matter how she goes to get a pedicure every other week. And it's just kind of like this funny thing that's like about her. And I think like a month ago, I would have been like, yeah, you know, that's weird. But it's like my brain just switched like a few days ago. And I was like, that's not normal. I wonder what that, like, what's behind that? Like, and so kind of to your point about how we used to just think, okay, my back hurts, I go to a massage therapist. It's like, oh, actually maybe it's something else. And I think that's like a new shift that I've had, you know, for myself. So I think it's cool that we're talking about this.
Yeah, I'm just going to spend 1 second on this because this is a great example. Chronic dry feet. Patient comes in and this is their chief complaint. Within Western medicine, we have moisturizer. And stop doing whatever the dumb things are that you're doing. And that's most of the conversation, right? Like, go get a pedicure. You go see a podiatrist. They're going to be like, well, this isn't, yeah, you already know the stuff to do. It's within our culture. Take care of your feet and you should be fine. Within Chinese medicine, we're going to say, why is this happening? And how do we make it so that you don't need moisturizer? How do we fix this from the inside?
Mm-hmm. And
it's easy to say, for example, what's wrong with putting moisturizer on every day? I use coconut oil for this sort of thing. It's helpful, it's nice. But the idea in Chinese medicine is that there is a problem on the inside. And if we don't resolve it, it's going to manifest in other ways over time. An example of this might be today's dry feet. And this is not for your sister, because I don't know her case. This is just an example, so I'm not trying to create anything scary. It's like today's dry feet plus 20 years, varicose veins, perhaps. There's something off here. There's something stressing the circulation in the lower legs. With us, we'd be looking at blood circulation and fluid circulation. Within Western medicine, it's like feet get dry. Chinese medicine, there is no, yeah, feet get dry. It's like, yeah, that happens, but it happens for a reason, and that reason is resolvable. Same with hot flashes in menopausal women. Like, that's not really supposed to happen within Chinese medicine, and we're good at getting rid of them.
Peter, I have a quick question. How often do you guys refer for labs, ask patients for blood work for their hormonal metrics if you suspect something is high? It doesn't matter if it's endocrine or glucose or ferritin levels, because I don't hear a lot of discussion about referring out for labs, and I think that could help.
Yeah, you're not going to hear about that until year 2. And the answer is it depends on the practitioner and what your focus is. So for example, if you're a fertility specialist in Manhattan, there's an endocrinologist on the team, right? If you're, I don't know, a sports medicine practitioner, probably never. Oftentimes we don't care very much, but there are plenty of people who integrate those different things. So I'm taking the doctoral program from Pacific College right now. One of the courses is, here are all the labs, learn them all. And here's what they mean and what they do. You're gonna get a somewhat simpler version of it right now, but often that's where I bring in a naturopath. My usual perspective is, if the case is not an acute case, if it's not something that suddenly showed up that looks really problematic, it's not raising any red flags for me, let's see how much progress we get in the next 3 weeks. And if we don't have progress, I'm referring you out anyways.
Okay, cool. Thank you.
Yeah, for sure. The number of things that in theory should need an endocrinologist that I've seen resolved with acupuncture without it returning is pretty high. The number of things that I've seen it fail on, there are some of them as well. That makes sense? Is that all the questions that were coming up? Jasmine, you got another question? Yeah, go for it.
Okay, sorry, just going back to the dry feet thing and then varicose thing. What if it only presents on one side of someone? Would that mean that it's still the same root cause, or could it actually be something totally different that's manifesting? I don't know what I'm asking.
Well, dry feet could have 20 different root causes. Like it's not, there isn't one, and the varicose veins is just one example. The presentation tells you a lot. We've got a whole set of diagnoses that are about things being on one side, and we see them showing up with shingles, for example, which tends to be unilateral. But it also might mean that they're doing something with one foot that they're not doing with the other foot. As soon as someone has a one-footed problem, I might be more interested in their shoes than I am in their circulatory system, for example. But it depends. You have to see the patient. And we'll get to what it depends means in just a little bit. Okay, I'm gonna try to push forward here a little bit. I'm gonna move a little quickly so we can get through a little bit more of this, at least through these examples, and then we'll take a break. Yeah, so oftentimes your patients aren't gonna present all of the symptoms they have because they don't know they're allowed to, because the fact that I have trouble falling asleep at every night is my problem, not your problem. When in reality, we want that data, which is one of the reasons why we have a fairly complicated intake form that we use in the clinic. We view disease pretty similarly to how Western medicine views it, but we also have a concept of health, so, and imbalance. So generally speaking, we're in large agreement about disease, that we have a different diagnostic system, a person's sick or they aren't. But all this imbalance stuff, that's pretty much our thing. That's all the edge cases on lab results. That's a lot of endocrine disorders. But it's also a lot of things that we're just seeing in the pulse and the tongue, and the person saying, you know, I just feel my digestion's, I've just been losing my appetite over the last week. And we treat them with some needles and some oxa, and it goes away and it never comes back. Or it comes back a year later because it's been recreated. Sometimes those are conditions that, if not addressed by someone who has a perspective that works for it, 2 years down the line turn into irritable bowel syndrome. It's like what starts off as mild abdominal discomfort turns into a big deal over a long period of time. Yes, IBS. Oh no, that's, what is an edge case? An edge case is, so an edge case, so if we have a circle that contains all the cases, the edge cases are the things that are right at the outside. So for example, if the normal temperature is 98.6 and someone's 99 degrees, it's like, do they have a fever or not? Yes and no, it's an edge case. If they have 98.6, they don't have a fever. They've got 102, they have a fever. They've got 99, who's to say, right? That makes sense? Every disorder has edge cases, right? Like one of the things that would be a problem for us is if we got too good at cancer detection, because the current estimates are we get cancer around 20 times a day. We just resolve it naturally. One cell of cancer doesn't mean you have cancer that we should care about. So what's the size where it matters? It's an edge case. We don't have an answer for that. We definitely know when it's a big problem. Yeah. Okay. Part of this is that Western medicine doesn't like self-reporting. They don't like subjective symptoms. A person saying, I have abdominal pain is one of the least useful things within a Western medical context, right? Or when I go outside, my belly hurts. I have a pet project that I'm working on. It's one of my favorite diagnoses within Western medicine that we also use within Chinese medicine, great overlap, which is called globus hystericus or globus pharyngitis, which is the sensation of something stuck in your throat that you can't cough up or swallow. I love this. We treat it reliably in under a week, semi-permanently. It has been untreatable within Western medicine for 2,200 years because there's nothing there. They scope you, they look for cancer in your throat, they look for obstructions. If there's nothing there, you go to psych because it's in your head. Within Chinese medicine, we call it plum pit qi. It's the interaction of liver and lung qi becoming congested in the lungs, in the throat. It's pretty straightforward and easy to treat. We like subjective reporting as much, if not more than, objective reporting. It's an entire medical system built on people's subjective experiences. Also objective, but subjective and objective are, I would say, equally valuable. You'll talk to different people and they'll argue about this within Chinese medicine. Some people will say I'm wrong, it's all objective. Some people will say I'm wrong, it's all subjective. But there are people functionally practicing this medicine who do nothing objective. And there are people functionally practicing this medicine who don't do anything subjective, who don't do pulse and tongue, who use machines to read these things. It works in both ways. Within Western medicine, the more it's subjective, the less it can be used. We see the subjective as reliable. That's a big difference. Make sense? Okay.
Peter?
I just talked about this example. Yeah, Marianne, go for it.
Hi, yes. So, well, two things. What was that called with the throat? You said, well, I just wanted to write it down for my reference. Globule. That was one.
I just typed it into chat.
Perfect, thank you.
I think I spelled that right.
Okay, it works. And then the other thing is, so if Western medicine has not been able to treat this because they scope and there's no evidence of disease or whatever, according to Western, but we traditional or TCM can work on this. Would you say that that would be likened to someone who has, I have several friends who have fibromyalgia or even RLS. And when I talk to them, or I just do my own kind of reading and research, more often than not, in fact, almost 100% of the time, they're told it's in their head. Are those two diseases or conditions something along the lines of like a globus pharyngitis?
If you hear the word syndrome, it means we don't know what's going on, right? That's what that word means within Western medicine. You should be taught that within your medical terminology course, but it's generally known, but it's not something that is discussed because that's an uncomfortable admission for the system as a whole. Like doctors know that, but it hurts to know that. Yeah, it's very similar. So it's a condition where blood work might be fine, levels of everything's within a normal range, or the things that are out of a normal range we can't bring back, or when we bring them back, it doesn't make a difference. So it's clearly something you're doing that's creating the problem. It's in your head because people's heads just get messed up and then things happen and that's bad. And it's biochemistry within your brain, or it's genetics, or it's these places where it's like, we haven't figured out biochemistry in the brain very well. So as soon as the answer is, it's probably biochemistry within your brain, it's like, we'll get to this. We're trying to get better at it, but we don't have a great answer. We have a set of different things we can do. Maybe it'll work, maybe it won't. If it doesn't work, we're kind of out of ideas. I've had really good success with chronic fatigue syndrome with Chinese medicine. I found it to be very effective. Fibromyalgia and chronic fatigue syndrome are both conditions where it's like, this isn't one thing. Different fibromyalgia presents wildly differently because it's a catch-all diagnosis for weird discomfort. Yeah. That makes sense? Does that answer your question?
Yeah, thank you. Thank you.
Okay. Give me just one more minute and we're going to take a break here, guys. So I just written up here as example 1 and 2, plum pit chi or globus pharyngitis. You will have patients who describe something like this to you. Even better, you begin to see when this is likely to show up, and while taking the pulse, you can feel a certain thing in your index fingers, and you say to the patient, when you get emotional, do you get a feeling of something stuck in your throat, and then you can't cry? And then your patient starts crying, and then their problem's resolved because they've thought it's in their head the whole time. Same with this one. Welcome to a normal menstrual cycle in the heads of a lot of women. I get highly irritable before my menstrual cycle, which, I should really stop doing that. I know it just drives everyone crazy, and I've got a lot of guilt and shame about it, but I just get so angry. And then I get all this pain, and then I'm just wiped out for 2 days, and then it takes me half a week to recover. We can probably get rid of that in a couple months, semi-permanently, and reliably and repeatedly, because that's not something that we would consider healthy. Okay, we should probably stop here, take a 10-minute break. I don't want to overextend you guys this early. I'll be back in just a couple minutes to answer questions. So break, you got 10 minutes. We're gonna be back at 2:20 EST. And we'll wrap this part up. And I'll be right back for any questions anyone has. Okay. So there's a bit of stuff about the Western medicine look at health. Let's talk a little bit more about the Chinese medicine version. So yes, we agree with Western medicine that if you don't have a diagnosis, that's healthy, but Western medicine largely stops there. After that, we care about proper balance as well. So you see some of this within Western medicine within the field of endocrinology, but it's still a field that has a lot of going on. And part of that is due to the inability to look at the subjective side of it in the same sort of a way. We care about this balance part kind of more than anything else. Some of the relatively extreme people within Chinese medicine, like the Worsley 5-element folks, this is all they care about. They treat pathology exclusively through balance. And there's good evidence from the Huangdi Neijing and similarly old texts that this is the way to do it. We'll get to that in a minute. But the balance part we care about. That means that the yin and yang are balanced well, that the 5 phases are moving correctly. You're not in the fire phase at 2 a.m., you're in the water phase like you're supposed to be. That all the organs are communicating correctly, and that the person's on whatever the right sort of path is for them. And we'll talk about that aspect in the Yang Sheng section at the end of the semester. Correct balance isn't static. This is one of the things that makes it hard to study, right? We're going to be adjusting what the correct balance is based on the season, based on the weather in the season. I'm here in New York. This ain't normal, the weather we've been having recently. That would shift what we're trying to strengthen within our patients, and it would also change the sort of pathology we're expecting to see. We've had swings from decently hot to decently cold. It snowed randomly a week and a half ago. These things we see as affecting the person's body as well, our patients. We're going to care about the age of the patient. What's right for a 50-year-old isn't right for a 15-year-old. The same sort of definition of health doesn't apply to each one. We're going to look at the constitution of the patient. We're not really talking about constitution in this class. We'll touch on it a little later. And then whatever the goals or destiny of the patient is. We don't set these, the patient sets them, but what's correct for an Olympic athlete whose entire focus and feeling of purpose in life is success within a certain sport, the correct way to treat that person is very different from the correct way to treat someone who lives a sedentary lifestyle and is happy about it, say a pianist, where there's physical activity, but it's a very different nature. So all of this comes together to say we're looking for a dynamic balance. We're not looking for things to stay the same. Same is bad in Chinese medicine. Within Western medicine, the general goal is to have things not change, which is the opposite way of looking at it. We also have gray zones and fuzzy areas, but we often have them within our profession. So people who specialize differently, people who look at different systems, people who come from somewhat different lineages or ways of thinking about Chinese medicine, or Japanese medicine, or Korean medicine, or Vietnamese medicine, are going to have different priorities and different values. This accounts for most of the infighting within our profession. If you get someone who does neurofunctional electroacupuncture in a room with a Worsley 5-element practitioner and a Dr. Tan needler, the 3 of them are probably all going to think the other people are kind of committing malpractice. We need to work on this as a field, getting better at communicating at these things, but we have different values even within the field. I'll share some stories about experiences I've had with this when we get later on into the class, later on into the semester. But the basic idea that we all kind of agree on is that there's a seed that starts the process of the creation of pathology. So long before the patient ever became diabetic, there were early warning signs that could have been easily adjusted. This is similar to the idea that if you take a ship leaving Tokyo, it's about a 5-degree difference between in the direction it leaves at to arrive in Seattle versus LA. But if you're most of the way to Seattle, it's going to take a huge course correction to turn the ship to LA. The earlier you can catch these things, the easier it is to change the outcomes. A really good Chinese medicine practitioner appears not to do very much because the people they treat just don't really get sick. Ideally, we're always acting at the level of imbalance, and we're not actually treating disease. This is shown in the Huangdi Jing, and in a couple of chapters, they talk about the hierarchy of medicine. One of the things that's mentioned is that the lowest form of practitioners are the ones who treat disease. That's a little much, but what I think that should be taken as is the more skilled you are, the more what you do is prevent the disease from arising in the first place. Make sense? Okay. So when we're talking about pathology, when we're talking about disease, not imbalance, but disease, this is it. 6 evils, excess and deficiency, kind of. And we're going to be spending the next week or so talking mostly about this stuff. And the last point to take away in this part of the lecture is that within Chinese medicine, lack of disease and health are not the same thing. They don't equal each other. It's a big shift in thinking from the Western medical model, which just says lack of disease, there's not really a reason to go to a doctor, but that doesn't mean that you feel healthy. All right, I'm going to switch over to the second aspect of today's lecture. Anyone have any questions about that last little bit there?
We didn't talk about emotions that cause disease.
We're spending all of next week talking about emotion. Yeah, we're just talking about external disease, but the idea is that the emotions are going to generate the 6 evils.
I see, I see.
Yes, yes. We're going to spend a bunch of time on emotion. Let's talk about something that Western medicine isn't good at talking about. There's no definition of disease, of emotion. What I call anger, what you call anger are different things. How do we talk about it? Chinese medicine has answered that pretty well.
And does Chinese medicine talk about like, if there's like greed, for example, greed or lust?
Yes, but not in this class.
Okay.
That's getting into more the Confucian branch of Chinese medicine, where concepts like propriety and correctness are very important. And then those other things are seen as ways of deviation from what is correct. Why do I repeat? Do I just have this open twice? No, okay. I'm having trouble opening the right file. 1 second. There we go. Okay. Yeah, those things are important. We'll talk about them later a little bit, but not really. Okay. So part 2 here. This is kind of what we're going to be talking about. I think the way that this is working right now, some of that before the midterm stuff is getting stretched into the second half, but these are the models that we're covering. These are heuristic models. These are ways of looking at the patient that result in the functional improvement that we want to get. They're not literal in the same way that a virus is. We can't find wind, for example, or wind cold in a microscope, but we don't care about that either. It's just ways of defining and working with patients, defining problems and working with patients. Each of these models don't really interact very much. They all kind of exist on their own. There's the same underlying philosophy and thought process. It each has its strengths and its weaknesses. And each one can kind of be specialized in, especially in herbology. Mostly what we're going to be talking about, and mostly what you're going to be talking about in your education here, are Zongfu patterns and internal and external pathogens and substance pathologies. Because of that, that's also what we're going to spend most of this semester on. Just to familiarize you with a little bit of the terminology, some of this should be stuff you've heard a little bit already. So Zongfu and substance pathology looks like heart blood deficiency. Zong Fu is the organs. The Zong are the yin organs and the Fu are the yang organs, or the solid and hollow organs. So Zong Fu just means organs, and substance meaning what aspect of the organ, and then pathology, excess, deficient, hot, cold. We also end up with we also end up with the internal and external pathogens, so that would look more like heart fire. But the way that we're always going to be talking about diagnoses is location. In this semester and for most of your education, though there are other options in the future. Most of the way we're going to be talking about these is location followed by type of problem, right? So we're going to name an organ, we're going to name an area of the body, we're going to name something, and then we're going to say what's wrong there. In those cases, yeah, go ahead, Lindsay.
So you said that the pathogen models won't interact that much, but will internal, external pathogens interact? Like earlier today, I had our clinic shift and there was an example of like a diagnosis, and it was like, I'm making this up obviously, but like lung, like cheese or liver cheese stagnation, like overacting on the spleen, like which something on the something, which something on the something. Is that interacting or is that something else?
The Zong Fu, so each of these is internally consistent. So when we're using Zong Fu and substance pathologies, let me go to my next slide, and I think that'll answer your question actually. And if I'll add a little bit on. So we're going to talk about things like, oh, heart blood deficiency. You've got your DTD series where you're going to learn a bunch of patterns. Heart blood deficiency is a pattern, and then you're going to learn how to treat them. In a clinical reality, what you tend to see, and don't be overwhelmed by this, it's less confusing than it looks, but it is confusing now. And it's actually the case you just mentioned. What you tend to actually see is something like liver qi stagnation with underlying spleen qi deficiency due to poor postnatal qi production, due to lung qi deficiency, due to lung yin damage from heat accumulated from smoking, due to metal phase issues, due to unprocessed grief, due to earth damage, due to disconnection from parents in early life. This is super common in smokers, for example. And the patient shows up and their chief complaint is discomfort in their ribs. And then as you start asking them about what's going on, we get this whole list of things: emotional volatility, difficulty connecting with others, inability to cry, cigarette addiction, binging on sweet foods at 4 in the morning, low energy, depression, anxiety, insecurity, and low back pain, to which they respond to all of those things. That's normal. When we're talking about Zong Fu pathologies, when we're talking about things like liver overacting on spleen, which is kind of a 5-element thing, but it's also described in other mechanisms within the body, a lot of this overlaps. What overlaps less from these pathogen models are the Shang Hanlun, Wenbing, possession stuff. This stuff overlaps, don't want to do that. This stuff overlaps pretty comfortably over here. Yeah, don't worry too much about that for now. This class is still largely an introduction to these concepts. And if this is confusing right now, don't worry, we're going to spend so much time on this stuff over the semester. It'll be you should be very good at this by the end of it. Hopefully I'm doing my job correctly, and you are. Okay, so what do I mean by possession? We are going to talk about that in about week 13. It's a concept that I love talking to psychologists about because it translates somewhat as acquired coping mechanisms, but it's a disease category that we have, not in TCM, because TCM doesn't do the spiritual side of things, but it's within standard 5-element practice, and you can read about it in Lonnie Jarrett's textbooks if you would like to. Or we're just going to talk about it later in the semester. So, okay, there's a little bit of debate about how to talk about this, but I think I'm going to whiteboard for this. So we have these ideas in Chinese medicine. We have a difference in Chinese medicine. So Western medicine, diabetes is a diagnosis. Then the question is, how bad is the diabetes? What else is going on? but you're kind of done here. Within Chinese medicine, we could say that diabetes is the disease, or maybe the disease category. But it's not really a diagnosis, or at least it's not a diagnosis we can work with. Some people are going to call this a diagnosis, but regardless of what they call it, this isn't actionable for us. We don't have enough information to treat this. This is one of the reasons why research in Chinese medicine is hard, because it's like, does Chinese medicine treat low back pain? Well, it depends on why they have back pain. We have a bunch of different types, and some of them are contradictory and exact opposites in terms of what we would do. And this will make sense as the semester continues. What we do instead is say, what's the pattern? And by pattern, we basically mean, what's the Chinese medicine diagnosis? In practice, this ends up being a huge point of confusion for a lot of students because it's unfamiliar and it's different. And if this isn't gotten right, Chinese medicine doesn't work super well. Often we're going to have names that look like Western medicine diagnoses that we start with, but what we're going to work on from there is not the same. So if we say diabetes, for example, in your head, that should sound something more like renal disease or liver disease. Not saying that diabetes is renal, but it should, or endocrine disease. That's not enough information to act on it, but we're getting closer to enough information. It tells us where the problem is manifesting, but it doesn't tell us much about where it's coming from yet. And it's not really something we can treat directly. Like, we have acupuncture points that are just good for diabetes, but usually that's 1 point in a 20-point combo, 10-point combo. So what you're going to be learning in the DTD series is how to do these diagnoses, or what all these patterns are. So let's take the example of coughing. DTD stands for Diagnosis and Treatment of Disease. I believe you're going to take a number of classes with that title. They may have just recently changed the title of those classes, but you've got a whole series where you're going to go through all the body systems and Western medical disease categories and Chinese medicine disease categories and talk about all the ways it manifests within the body. And you're going to be tested on that aggressively for boards. And that's the core of a lot of what you're going to be doing in practice. So the first question within Chinese medicine is, so we have coughing. What is coughing? Okay, in a Western medicine context, it's some sort of a lung spasm causing an expulsion of air from the lungs, right? It might be diaphragmatic, might be conscious or unconscious, doesn't really matter. That's what it is. Within Chinese medicine, coughing is lung qi counterflow. That's it. That's the whole story. Thank you, Veronica. Coughing is lung qi counterflow. It's lung qi moving the wrong way. Lung qi is supposed to move in and out. When you're coughing, it's moving out inappropriately. We have the same thing for burping. Energy isn't supposed to be going up the stomach channel. It's supposed to be going downwards. When it moves upwards, we get burping. When it moves up more, we get vomiting, right? Just counterflow. So we already know why they're coughing, or we already have a different word for coughing, which is lung qi counterflow. But then the question is, why do they have it in the first place? We have points that help with stopping coughing, but we want to treat the reason the coughing started in the first place. For us, that can be anything that disrupts the lungs. So some of you may have noticed that it's not uncommon that people start coughing when they have a lot of emotions. We tend to see that when, excuse me, we tend to see that occur when wood is insulting metal. Of course, I start talking about coughing and start sneezing and coughing over here. It can be an invasion from the exterior, directly causing the coughing. Thank you, Allison. So we get into things like, oh, there's dust in the air. That's more of an external thing, which might be what's going on here right now. But we have all these different causes of why something like chronic coughing would be an issue. And if we're going to address it, we need to know what the underlying cause is. It could be that there's a lack of fluids in the lungs causing dryness. It could be something from the outside coming in. It could be emotional related. There really are many different ways that it can manifest, and we're going to treat every single one of those things differently. So the idea of saying, does Chinese medicine treat coughing, is a very hard question to answer, because we don't treat coughing. We treat the causes of coughing, and we're good at some of them and we're bad at some of them. That make sense to you guys? Yeah, Jasmine, question.
How do we know if, like, say, coughing can be liver invading spleen? How do we know if it's related to that, or if it's related to someone's lung qi, or?
That is next semester in FCM3. You're going to learn all of the different diagnostic tools that we have. So that's where pulse and tongue diagnosis come in, and that's where a whole other set of questions come in. So for example, can you guys type really quickly, what's the tissue associated with metal? Right, skin. Skin and body hair, good. So if a patient has, for example, lung yin deficiency or lung fluid deficiency, either one, we would expect to see that also manifest on the skin and hair, which would mean we would expect to see dry skin in that patient. That would be an indication, a comorbidity or another manifestation of the underlying issue. Don't worry about understanding that yet. That's what next semester is for. But the idea is that if there's an issue that's resulting in the coughing, we should see that issue in many other places within the patient at the same time. Pulse, tongue, and a bunch of other things. So a patient who has blood deficiency, we're going to expect to see something going on with their vision about half the time. Floaters, easily tired eyes, dry eyes, that sort of a thing, because of the connection between blood to liver to wood to eyes. This might sound complicated. It gets pretty easy. Takes a little while, but it gets pretty easy. Okay.
Can I ask one more thing? Sorry.
Yeah.
How are there a list of things that we can relate to liver invading spleen, or is there something specific that makes us think it's liver invading spleen?
We're going to talk about that when we get into the yin organs later this semester, but yes, that will manifest in a specific way or a specific set of ways. Yeah. Okay. So coughing, fairly straightforward. It's lung qi counterflow. Every time it's lung qi counterflow, and the question is why. Diabetes is a little bit more complicated. For us in Chinese medicine, the diabetes diagnosis, just like coughing, is a manifestation of something underneath. The thing underneath is a heuristic tool. It's maybe a metaphor. It's not necessarily real in the sense that it's something we can see under a microscope, but it's a pattern that we can see, that we can repeatedly treat, and that often has been done so hundreds of thousands of times over the past 2,000 years. Given that diabetes is discussed in the Huangdi I Ching, which is somewhere between 2,000 and 3,000 years old, we got a good track record with at least looking at this. We call it wasting and thirsting disorder, which is if you don't have insulin and you have diabetes, people tend to lose weight, not in a healthy way, wasting away. For us, we look at 3 different manifestations of it. So within Western medicine, there are 3 things that you expect to see frequently with diabetes: persistent hunger, persistent thirst, and loss of weight. Persistent thirst is doubly interesting because you tend to see a lot of urination with diabetics. They tend to urinate frequently, tends to be relatively clear, and yet they're always thirsty. You can have 1, 2, or 3 of these things, but the wasting away doesn't usually show up without one or the other symptom showing up. You can have gnawing hunger by itself without the wasting away, but if you have the wasting away, you're going to have gnawing hunger or persistent thirst pretty much every time. And the reason for that is that we have 3 different diagnoses. I'm going to switch this over to the whiteboard again. We have 3 different diagnoses for diabetes. And again, this is type 2, not type 1. So if a patient has gnawing hunger, they come in, they say, yeah, I've been diagnosed with diabetes. I'm coming to you because I hear acupuncture can help with the fact that I'm always hungry, right? I know I'm diabetic. I shouldn't be eating all the time, but I'm always hungry. Gnawing hunger is a symptom of stomach yin deficiency. If a patient has gnawing hunger, they probably have stomach yin deficiency. There's some other diagnoses that can show up. Stomach yin deficiency can manifest as diabetes. It can also manifest as something like stomach ulcers. Stomach yin deficiency can look like a number of different diseases. There's more than just this, but don't worry about too much complexity right now, just looking at the theory of it. Stomach yin deficiency can manifest in a bunch of different ways, but if we have diabetes, we know that this is a possible diagnosis. And then we can treat this directly with points that nourish yin and herbs that nourish yin. And that would be how we would begin treating this diabetic patient. We're not going to be treating the diabetes, we're going to be treating the reason for the diabetes. This, in theory, making sense to people? If it's not, please ask a question.
Peter, I have a quick question.
Yes.
In this situation, would you ever see stomach ulcers alongside the diabetes?
It's possible. I haven't, but it's totally possible. I mean, yeah.
Thank you.
Yeah, for sure. Yeah, if a patient comes in and they say, I have diabetes with gnawing hunger and a history of stomach ulcers, then you've pretty much finished your diagnosis, for example. Another example would be the patient could have constant thirst or persistent thirst. This is all in the notes as well. If they've got persistent thirst, that's not a stomach yin deficiency condition. That's a lung yin deficiency condition. Lung yin deficiency can also show up as a dry cough. It can also show up as eczema. It can also show up as IBS when you get to the diagnosis level, because the lung being metal, large intestine being metal, this dryness transmits down to the large intestine, causes that. This lung yin deficiency can manifest in a bunch of different ways. One of the ways it can manifest is diabetes. If it does, we expect to see persistent thirst. How we treat this has some overlap with stomach yin deficiency because the two are somewhat connected, but we're going to use a lot of different points. We're going to use a lot of different herbs. The end treatment's going to be quite different, despite the fact that the manifestation of both is diabetes, right? And the last one, which is wasting away as the chief symptom, is going to be kidney yin deficiency. Don't worry about the specifics of any of this. I just want you to get the general idea here that these can manifest in different ways depending on the symptoms, or the symptoms indicate that they're manifesting in different ways. Kidney yin deficiency can also be low back pain, commonly seen in diabetics. It can also be impotence, infertility, premature aging. Oh, that's above the camera. And like 1,000 other things. So when the patient shows up with diabetes, we start asking, what else is going on for you? That gives us an indication of what we're working with. Interestingly here, lung yin deficiency, stomach yin deficiency. Oh, that was bad. Pretty easy. Not super easy, but pretty easy. Kind of hard. So is Chinese medicine good at treating diabetes? Which one? Becomes the question that we have. Because they're different. They manifest differently, we treat them differently, and our ability to treat them is different. Okay, that making sense? And again, in theory to you guys, you really don't have to memorize the types of diabetes. That's not what we're doing here. I just want to make sure that you're getting that we have a different diagnostic system. This whole pattern thing.
One more question, Peter.
Yeah, please, please. I like you guys asking questions. It's a good thing.
Okay, good. Do you ever see a diabetic, like, I guess just diabetes presenting in multiple of those three ways, or is it typically?
Yes. It can be any combination of those three things. If you have the wasting, you almost always have one of the other ones, because stomach yin. So often what you get is, what you often get in a patient is gnawing hunger. This is just an example, which makes them snacky. Plus 5 years. And they would get wasting, except they're on insulin now. So diabetes diagnosis. Kidney insufficiency type diabetes diagnosis. Within our culture, what this patient is going to think is, it's because I've been snacky. I've been snacking all this time. I know I wasn't supposed to snack. The snacking itself is a manifestation of the gnawing hunger. The gnawing hunger is due to stomach yin deficiency. The snacking itself, not really the problem. The problem is this underlying thing. That makes sense? But once they get to this type, this would be kidney yin with stomach yin deficiency. They can have lung yin deficiency on there as well. They can have 10 more things on top of that. I'm not going to try to put you guys through any of that right now, because that's much more complexity than you need to deal with. But yes, it can be multiple types. Okay. Nicole, you have a question?
I do. Sorry, it was kind of piggybacking onto that. But so we're talking about kind of catching something before it happens. If you have someone younger coming in that can never keep weight on them, is hungry all the time and that kind of stuff, would you start looking at that as in the Chinese medicine version of whatever that is, pre-diabetic? Or would you, like, how does that work for you? Is that something that you would adjust the same way maybe, or?
The younger you can start working on any of this stuff, the better. I mean, Chinese medicine in its best form is preventative medicine. So when you have someone showing up where it's like, oh, these are just quirks of this person and they just can't put on weight, in our medicine, they might be 20 years too early to have a problem, but this might be the sort of thing that builds slowly over the course of their whole life and creates a lot of problems. Whether or not this particular case has anything to do with potential diabetes, I have no idea.
Sure.
I have no idea. But and I certainly don't want to be a fearmonger about this. Like, people go through different stages of development. Like, that's a whole complex field. But yeah, we like to work with things early. I love working with younger people. They respond quickly. It's great. Yeah. Can someone have diabetes but not show these patterns? Depends what medication they're on. In a vacuum, in theory, no. Weird stuff happens. Almost no would be the answer. Sunmi, what's up?
Yeah, I guess, I have a question about the wasting away part.
Sure.
Because usually a lot of diabetics are struggling with being overweight.
Yes.
How does the weight, and I understand the kidney deficiency part, but kidney indeficiency, but how do you reconcile the two with like the weight gain?
Sure. The wasting away is something that you see in uncontrolled diabetics who are in a fairly critical situation within contemporary times. But if you're looking at diabetics who aren't using insulin, they tend to start fairly large and they tend to lose that weight because uncontrolled diabetes wreaks havoc on your system and you start burning all of that off. Contemporarily, when you can use insulin to prevent that level of systematic damage, you don't see the wasting away until the person's in kind of an end stage of it. And then you still do sometimes.
Oh, okay, thanks.
Is this the same as insulin resistance? It depends. More complicated than we're going to get into here, because insulin resistance doesn't mean a lot within Chinese medicine, but before the stomach or lung insufficiency or kidney insufficiency, there's usually smaller things in advance of that as well. But this is not the class where you learn that. This is just the class where you learn that this is how we think about things, right? You're going to spend a ton of time on diabetes in like a year. Okay, let's get back to these notes. We might not get through all of this today, but I'm going to make sure we get through the parts that I think are especially important. And then I expect you guys to read the rest of it on your own if we don't. But the questions are really important because so much of this is about how we think that I need you guys to talk to me to know where some of it's confusing. And please bring me questions on our Slack channel and we can talk about it all the time. That's our version of the chat box that lasts all week. Okay. So there's a ton of things that can cause this yin deficiency. It can be external influences, it can be internal influences, it can be emotional influences. It can come from a bunch of different areas. And if it's coming from something else and that stimulus is still occurring, then we have to deal with that as well. We refer to this concept as root and branch. The root is the deepest cause we can find, and the branch is the most superficial manifestation we can find. Oftentimes, what Western medicine is focused on is the branch. What we try to focus on in our diagnosis is the root, but then what we actually do in practice is very complicated and situational. It's not very complicated, that's an exaggeration. What we do in practice is figure out the right balance of root and branch for the person in the moment. And different ways of practicing Chinese medicine believe that different types of balances are more or less correct. And we'll spend time on this. So for example, we got right here on this slide, you guys can see this slide. So if coughing is the disease category, is the branch, lung qi counterflow is the branch diagnosis. It's like, oh, we have coughing because we have lung qi counterflow. That's our branch. And the root is liver insulting the lung, then we have our root. If the root is they live in a house with a lot of particulate matter in the air and we're having a dryness invasion into the lung, then that's the root. If we don't resolve the root, we might be able to get rid of the branch, but it'll tend to regenerate, it'll tend to reform. Anything that you have to treat every day forever, you're probably working on a branch, not a root. If someone's going to their acupuncturist for, let's say, nausea, and every time they go, they're better for 2 days, and then it comes back, their acupuncturist is probably treating the branch and not the root. Same with insomnia, same with menstrual problems. It's like, oh, it's better, but if I stop seeing my acupuncturist, it comes back. It's like, yeah, that's because your acupuncturist is refilling the bucket, but they're not plugging the hole in the bucket. That's the problem in the first place. Yeah. Yeah. And all of this gives me enough information to now tell you what it depends means. You guys are going to hear this phrase a lot from your teachers. You're going to hear it in the clinic because oftentimes it's the only short way to answer a question. And what it means is that's not really a question that can be answered. So it depends is the answer for how do you treat diabetes? Because we don't treat diabetes. We treat the patterns that can result in diabetes, and each one of them is treated differently. it's similar to saying within Western medicine, what drugs do you give for endocrine disorders? Well, it depends on the endocrine disorder. It depends. So when you hear it depends, I'd recommend reflecting on why that's the answer that's being given to you, and attempt to drill down, if you have the time, with the professor, like, how would this question be better? What is it about this question that doesn't allow for a straightforward answer? And we have a concept in Chinese medicine that the same branch can come from many different roots. There are many things that can cause a person to have, let's say, a chronic cough. At the same time, one root can cause many different branches. A person with lung yin deficiency can have that manifest in irritable bowel syndrome, in dry skin, in a dry cough, in a bunch of different things. This might sound confusing. It's actually a lot less confusing than you think. It just takes a little while. This making sense? Okay. And you guys have all these slides as well, so feel free to review them. Doing pretty well on time. Let's take a little bit of an early break before we get into the last section here. We got a lot to cover in it, but that was a lot right there. I'll be right back in a minute to answer any questions that come up. And again, if questions come up over the course of the week, you just post them on the Slack and we'll have a discussion about them, and yeah, should be good. All right, see you guys in 10 minutes at 3:12.
I have a question.
Shoot.
Is there like certainty in the treatment of acupuncture due to the fact that the root sometimes can be the root, sometimes it can be the branch? So like how you find what's the root, what's the branch?
That's the part of, that's one of the main things you're going to be learning. I mean, I refer to it as a causal chain, right? So ultimately, you know, your patient comes in with a problem, and your question is to figure out why, but then you're usually asking, why that? Why that? And you do this until you get to a place where you can get a lot of leverage on the issue, where you can create change in a functional way. And then, so it's like, oh, this why right here, we're really good at treating this why. If we act here, this erases, and then just slowly that starts undoing everything all the way up. We're going to spend a bunch of time talking about some of the theory about how to think about this, but this is a big part of the reason that you have so much time in the clinic, because the best way to learn this is to do it over and over and over again. And one of the questions that you might want to be asking in the clinic for patients who come in with charts that are this thick is, have they been treating a root or a branch? Can we go deeper? Oftentimes going deeper gets you a solution, but we'll talk a lot more about it. This is where a lot of the challenge in Chinese medicine comes, is figuring out what level is the correct level to be working at any given time to get the most effect, both now and in the future.
Because like sometimes lung qi counterflow can be the root, sometimes it can be the branch.
Yep.
Okay, so it's very interesting, those concepts. It's like it's quite very deep. It's very deep. It's like those are very deep concepts. Yep. They cover, like, because you know, it's like 1 week it's 7 days, but like, does 7 days make 1 week, or 1 week stands by itself and the 7 days stay by themselves? In other words, it's like different categories, and you don't mix them together sometimes.
Yep.
Okay, so
we care about why and causality a lot. We care about the causes of things, and there are branches of Chinese medicine that like the 5-element people especially, I mean, I'm just picking them because they're a well-known one that you'll hear talked about some, and there's a school there's a school in Boston that teaches this sort of thing, and Lonnie Jarrett does this, and there's some people in Florida who do it. You're going to encounter these people where like they're going to go 20 steps backwards into stuff that happened 10 years ago to figure out why you have shoulder pain. Like that doesn't mean that that's the right way to do things, but that's the way that they do things. I'm not here to tell you what the right approach is. I'm here to give you an overview of the approaches, because they're all, the ideas are all the same. It's just different weights in different places. Yeah. And some people are like, but I'm just here to, like, my patient gets calf cramps. My job is to stop them getting calf cramps. And another person comes in and like, the calf cramps are because of this thing, because of this thing, because of this thing. How you want to approach that is up to you, but I want to give you the tools to be able to explore all the options. And if you have enough tools, then you don't get stuck as much clinically. That make sense?
Yep, well much, thank you.
Feel free to start a discussion on Slack about root and branch stuff, and I will go hard onto it. Are appropriate times where treating the branch is necessary? Yes, 100%. We'll talk about that in 2 weeks. Sometimes you just treat the branch, sometimes you just treat the root. Usually you treat a combination of different things. In herbology, this is what the stop coughing and wheezing and the stop bleeding categories of herbs are. It's all branches. That's all those are. We use them all the time. But we usually use other things at the same time. What if the treatments for different roots conflict? Then you have to make a judgment about where to start and how to approach it. And that is where, that I think is probably one of the harder aspects of Chinese medicine, is figuring out, like, if a patient simultaneously has a cold deficient situation and an excess heat situation at the same time, it's like, well, which one do we start with? There are ways to think about that. There are different schools of thought. It's very situational, but it's ultimately where a lot of what we're really good at is too, where the really like sudden, artful, giant changes happen. What if treatments for different roots conflict? Lung dryness and damp spleen. Well, so that's a great example. A damp spleen can cause a dry lung. We might just start there. Dampness and dryness existing simultaneously is not remotely a conflict. We can treat both of those things simultaneously. We'll get into that later. We're not going to really talk about how to do the treatment, but we're going to talk about the theory of it, and you'll learn more later. It's a lot harder to treat something like dual heat and cold combined in the intestines with simultaneous intestinal qi deficiency, spleen qi deficiency, and kidney yang deficiency. Like, there are combinations where it's like, oh man, that's an onion. I don't really know where to start. And you work situationally with it and you see what you can do. But a couple of things, not too bad. Sometimes you'll have 15 diagnoses for the same patient, and that's when it gets hard. But that's part of the process. Okay, any other questions before we start back up? All right, we're gonna start back up. Last set of slides for today. Okay, I'm going to kind of whip through this first part here, because this is again just a brief overview about something. We don't really come back to that this much in this class, but I want you to be introduced to the concept. We have a lot of classic metaphors for how to talk about the body. At some point, you guys should probably read the Huangdi Neijing. Probably a good idea. And they talk about this sort of thing. This is where this comes from. And the idea was, okay, so, I mean, I think we could do something like this with Western medicine at some point, but the idea was, okay, a bunch of people who are working as physicians need to explain medicine to a bunch of politicians. What's the best way to do it? Let's talk about the systems of the body as if it was a city, with all these different departments and all these different people running it. Chinese medicine has within it pretty deeply the concept of like, as above, so below, as within, so without. So the idea of the body working like a city is pretty, that's like, yeah, that fits. And so what they did was they created the court of the organs. So the heart functions as the emperor. First off, to understand this really well, you have to be more educated than I am, I think, about how ancient China worked. But yeah, the heart functions as the emperor. The emperor, the job of the emperor was to perform the rituals that kept the world moving properly. It kind of doesn't do anything and kind of does everything. But the emperor doesn't directly do much. It just does the things that make everything work behind the scenes. The lung works as the prime minister. The lung's in charge of a lot of the regulation of the body. The liver's the general of the army. So someone who goes to war too much or too little, we're probably looking at the liver. Someone who fights too much, someone who's a doormat, we're probably looking at the liver. Pericardium's the envoy or the ambassador. How do you present yourself? How do you communicate with other people who are new? That's a lot of that's the pericardium. Kidney's the minister of health. Your overall health is usually going to be derived from the kidneys itself. We'll talk about that a little bit later, but that's really the essence that we're talking about there, the jing. The spleen and the stomach are the official in charge of the granaries. Originally, the spleen and stomach were one organ within Chinese medicine with two aspects. We've divided it over history, but spleen, stomach, granaries. So it's the storage of all your resources. A very common diagnosis that we see is liver overacting on spleen, wood overacting on earth. A way to talk about it within this framework is if the general of your army believes that you need to go to battle to protect yourself, the first thing that they're going to do is collect resources from the granaries to make sure they can feed the army. You can talk about this in terms of fight or flight. If what you need to do is survive for the next 10 minutes, then you don't care about creating resources to survive for the next month. Let's get through the 10 minutes first. The gallbladder has a very interesting function. The gallbladder works as the secret spy of the body. It's also the official in charge of decision-making and forward movement. The gallbladder is very interesting in Chinese medicine. Quick review from last week. Let me just remind you that when we say gallbladder, just with all the organs, we don't mean the physical organ. We mean the abstract concept of the gallbladder, the dan, out of which one of the things we mean is the organ, and of equal importance is yang wood, and of equal importance is its function as a spy. So if someone has their gallbladder organ removed, it may or may not mean anything for what we're talking about here, because we're not talking about the organ. We're talking about an abstract concept that happens to have the same name as the organ. It's a little confusing. You guys with me on that? Okay, good. I'm seeing some thumbs up. If you don't understand, please let me know. Okay. Large intestines is in charge of transportation. It's a fancy way of saying that it's in charge of transportation and conveyance, which is a fancy way of saying it moves poop through itself. The small intestine is the receiving official. It receives from the stomach and the stomach and the spleen, receives, passes it to the large intestine for transportation. Sanjiao is the official in charge of irrigation and waterways. And the urinary bladder is in charge of the outer districts. So if we think of the body as a city, the urinary bladder is in charge of all of the small towns and areas around the city outside of the walls. We're going to talk about these organs in a number of different ways. I just want to introduce this concept to you. Some people really enjoy the anthropomorphizing of these. If you're going to work with psych patients, this is an interesting way to employ it. So each official is its office and what it governs, roughly. And within that, we can think of the chi of that organ as the people that it employs. So our lung chi is the lung's ability, is the number of people who will do what the lung asks it to do. The blood is the resources that they have. So you can have a lot of people working for you, but if they don't have desks and computers and pens and pencils and postage stamps, they can't do as much. The yang is how motivated those employees are. So you can have employees, but how much they actually care and how hard they work, that's more the yang. And then the yin is the infrastructure. So the blood is the computers, the desk, all that. The yin is the building they're in. So if we say, yeah, so an example with the liver, So the liver's the general of the army. That means the chi are the soldiers, the blood are the provisions that they have, the food, the yang is their morale, and the yin is going to be their equipment, and including the tanks, the everything. You don't have to, you will not be tested on this. I'm just trying to give you a general feel for it. Already said this. So a patient comes in, I have anger issues. Okay, what are your anger issues? Well, I just get in arguments with people all the time. You know, I feel like people invade my space and then I lash out at them. Okay, well, we already know which organ we're going to be working with. One of the first ones we're going to be working with is the general of their army. They fight too much. They're ready to go to war. You get another patient who comes in who's like, you know, I'm depressed. Why are you depressed? People just walk all over me all the time and I can't stand up for myself. Oh, there's a correct amount of fighting. How we regulate that correct amount of fighting is going to be largely through the liver. Why is the general not acting correctly? So the question that we look at with these organs is the prime minister within this person doing the proper job? And part of this is going to come back to, this is the sort of thing that we used to work with. Well, not we, our long ago predecessors used to work with as an anatomical drawing of the body. We have different ones that are much closer to an actual physical, contemporary physical drawing. We have ones that look a lot more like an energetic representation, but this one's more in the metaphorical city-state version of it. And there are many different types like this. So this model on its own can be a lens for diagnosis and treatment. There's some people who think mostly within this framework for most of what they do with their patients. I'm not one of them, but there are people who do this. If you spend a lot of time studying like Confucian concepts of how a city is supposed to work, how an organization is supposed to be run, and you look at a patient and you can ask yourself, which people within this organization aren't working properly to get the results that we're seeing, then you can actually use this as a functional way of treating people. It's not going to do everything, but it'll have some unique areas where it can work well and can be an interesting way to look at psych patients. And even just at this stage, as a very low resolution model without a lot of detail, it can be an easy way to start getting a little bit of a feel for the organs and what they do. Kind of said this. So the organs are supposed to behave like the archetypes that they embody. So if a person's having the anger issues, it's like, well, is the general appropriate or inappropriate? The person who's very constipated, it's like, okay, well, the large intestine is in charge of transportation and conveyance. In what ways is it doing that well? In what ways is it doing it poorly? A patient with diarrhea, it might be too much transportation and conveyance. Okay, how do we bring that back into regulation? Yeah. And so then the question becomes like, okay, if the prime minister is not doing a good job of organizing the body, which resources are they lacking? Do they need more people? Do they need more motivation? Do they need more resources? And then we can use points to nourish the blood, to nourish the chi, whatever we need to do. So a little bit of a deeper example of this. Your patient comes in and reports that they're still having negative effects in their life from being abused when they were younger. So unprocessed violent trauma from their past. Usually, this causes the liver, the general of their army, to act inappropriately, either too active or not active enough. With enzyme food diagnosis, that means there's usually some sort of a liver excess or liver deficiency. We don't know of what yet, but some type. What this means is that we have the same root concept of, let's say, the deficient type being liver blood deficiency and the excess type being liver fire. Someone with unprocessed violent trauma from their past might manifest that as just hypochondriac pain in the ribs. Another one might manifest that with angry outbursts. Either way, this root of the liver diagnosis is going to be the same, and we're going to treat it similarly. once we talk about the court, an idea shows up of, well, what's at the edges of this? And within the Chinese way of looking at this, it's always a walled city with border guards. So at the edge of your metaphorical city, you've got a wall, and with our bodies, that's our skin. That's our actual boundary. Control of the border is managed by the prime minister, not by the army, but by the National Guard, and or by the immigration and customs. And what manages the outside of the body is the Wei Qi. 1 second, Jasmine. I'll get to your question. So the skin is the physical organ of the lungs. Metal is the phase that governs all boundaries, and the lungs govern Wei Qi. The lungs and the large intestines are both organs that actually interact with the outside world, right? There are a bunch of different ways where simultaneously these two organs and the metal phase itself are interacting with boundaries and our skin and our protection and our defense. And we can come at it from different angles, looking at the organs, looking at the body tissues associated with the organs, looking at the organs themselves and their interaction with the outside world, looking at this as a walled city and the function of a prime minister. All of these point to the same organs being in charge of the same things. It's one of the nice things about these systems. They tend to be fairly consistent, which means the further you go into one way of looking at it, the better you begin to understand it from other perspectives as well. Yeah, Jasmine, what's your question?
I kind of had a few. Is the reason that unprocessed violent trauma affects the liver because the liver is a general, or is that just a pathway it takes for being stored, or?
Unprocessed violent trauma could affect a lot of different things in a person's system. In this case, I'm just using it to talk about the general specifically. I'm just using that as an example for the general, in the same way that if, let's say the United States suddenly comes under attack unexpectedly from an outside force, our military freaks out. The same thing happens to a person's system, a person's body.
So it could also affect other organs. Well,
100%. Yeah.
Got it.
Yeah.
Yep.
Mm-hmm. Okay. Let's go a little bit deeper into Wei Qi here. So we're going to start walking away from the body as a walled city idea. You guys learned about Wei Qi, at least briefly last semester. You talked about generation of Qi, right? Good. I'm seeing a few nods. That's good. Cool. Okay, so Wei Qi circulates in the skin. Technically, it circulates in the soli, which is an empty space in between the skin and the muscles. That's how it's written. And it controls the opening and closing of the gates in the wall, which means the opening and closing of the pores. And it protects the body from the 6 evils, from external pathogens, which is what we're getting into next. So on the outside of your body, on the walls that guard the city that is you, you have border guards. They control the opening of the large gates that allow things in and out of the outside of your body. And if your army isn't present at the gates, then external forces can come in without being harassed at all by you. When an evil, when something bad from the outside, we'll define evil better in a minute, but when something bad comes to try to get inside of you, your Wei Qi goes to battle with it. If the Wei Qi is stronger, you don't notice anything at all. If they're evenly matched, then you end up in some level of a battle, and often the pulse will briefly become floating, and you might get some shivers or a couple sneezes like I did just a little while ago. You might suddenly break out in a little bit of a sweat, and then it usually passes and you're fine. And if the pathogen is stronger, then the pathogen comes inside of your system and you get sick. And the type of sick you get depends on the type of pathogen and what your body was like before it came in the first place. This is one of the aspects of preventative medicine. If we can build up a person's Wei Qi, then they're less likely to get sick. It will take a stronger and stronger pathogen. External disease, this is the entirety of what can get into your body. The 6 evils listed on the left, and a couple of modifiers. sometimes these show up as well, but they don't show up by themselves. They don't exist as external things on their own, so you can have an invasion of heat or fire, an invasion of dampness, invasion of dryness, of cold, of summer heat, or of wind. You can't have a phlegm invasion or a toxin invasion. These do combine together though. So the common cold is usually a wind cold invasion, like rhinovirus, usually a wind cold invasion. You can have a wind cold phlegm invasion as well, as an example. Don't worry about exactly what they look like yet, just giving you the set of things that are possible. This is it. This is every disease that you can contract from the outside world on this one page. That's all external disease. They combine to make compound pathogens. You can have wind heat, you can have wind damp heat, you can have wind damp heat with toxicity. These are all possible things that you can get. You can't have contradictory traits. So you can't have wind damp dry or wind hot cold, and you can't have modifiers on their own. You can't have toxicity as an invasion, and you can't have phlegm as an invasion. That being said, this is so like wind hot cold would be kind of like saying the person got a bacterial virus. That being said, someone can get a bacteria and a virus, but they're separate things that just happen to happen at a similar time. So someone can have a wind cold and a wind heat invade them, but they can't get a wind cold heat invasion. So are all the 6 evils external? No. But we're going to separate talking about disease into external, internal, and miscellaneous diseases. And the 6 evils are fairly consistent through all of those, but look a little bit different. So whether it's an external invasion or an internal generation of the 6 evils, they'll have a different nature. But it's still the same terminology, and it's less confusing than it sounds like. What is an example of toxicity? So a wind damp invasion could look like suddenly getting a phlegmy cough, kind of like flu-y with a lot of mucus coming up. It's toxic if the mucus is also dark green and smells bad. It's oversimplified and overgeneralized, but that's basically what it looks like. So like a wind heat rash, someone who's outside and they, something happens and they get like a reddish rash on areas of their body. Wind heat, no big deal. Wind dryness, no big deal. If it's also toxic, then it's also gonna have like yellow pustules. We don't see a ton of toxicity in our lives these days, mostly due to cleanliness. Poison ivy is going to fall into the miscellaneous disease category, and we're not really going to talk about it that much for now. Dog bites, insect stings, poisonings, heavy metal toxicity, all of that's going to fall into the miscellaneous disease. External disease is stuff that happens normally in the world without something having gone wrong or being an error. Don't worry too much about that exact definition right now. We're going to drill down into this. You should all feel very comfortable about these terms by the time we're done. So, we got good time. Okay, so when we're talking about the 6 evils, these are all pathological versions of the 5 phases, of the 5 elements, right? So earth, that's dampness. Metals, dryness. You guys remember this from the chart, right? These are the pathogens associated with these things. Earth is also summer heat. Summer heat's over on the side. We'll talk about it later. Summer heat largely doesn't exist anymore, but we'll get to it. It does, but not really. So heat, damp, cold, summer heat, and dryness are by themselves are not very common anymore. So out of all of the possibilities of diseases of external invasions that we have, most of these don't happen much. Each one of these evils requires an outside environment of that nature to overcome you. So places we do see this would be something like a patient with sinus congestion who lives in Maine, who moves where it's relatively cold and often damp and snowy, who moves to Utah to the desert and their sinus congestion goes away. That consistent dampness invading their system is causing these problems. this is the sort of thing that, like, going back 100, 150 years, that's like, oh, the person who's got rheumatoid arthritis who moves somewhere warm to help get that dampness out of their system. It's the climactic change solving climatic problems. Climatic problems. So when in these conditions, your Wei Qi is constantly fighting the external environment. It's always being worn down by the external environment, and you're always building it up through nutrition and exercise and breath. This food, clothing, exercise, herbs, other therapies. So this is the difference between whether or not someone gets a cold invasion is how much Wei Qi they have in cold weather. If I go out in cold weather as a relatively excess person with pretty strong Wei Qi, and I'm with a friend who's relatively deficient with weak Wei Qi, the cold is going to become a serious problem for them before it becomes a serious problem for me, assuming we're not compensating with clothing or other things, right? That's your Wei Qi keeping the cold from invading you. Same with heat. I'm more likely to have a problem with a lot of heat in the desert because I'm relatively excess than someone who's relatively cold. When we talk about actually getting, so this is like on the extreme level, this is heat stroke, this is sunstroke, this is frostbite, this is those sorts of disorders. We still treat this stuff sometimes. It can show up in odd ways. Cold, especially cold invasions from the outside, can linger and show up in interesting ways. And we're going to talk about that later in the semester. But most of this has been dealt with by our management of our internal spaces with central heating and central cooling. Anyone who's spent a summer in a very hot environment without any air conditioning knows how much it can begin to affect them. That's what we're talking about here. But when we talk about what we would generally think of as getting sick, we're talking about wind plus something. The two most complicated and common and well understood versions of this are wind heat and wind cold. Both of these pathogens have an entire school of thought and a whole set of literature behind them. When we're talking about wind cold, we have a book called the Shanhan Lun by Zhang Zhongjing. Shanhan Lun translates as the Treatise on Cold Damage. It's mostly an herbal text, but it's also a diagnostic text. And it created the 6-stage model that we use for tons of different things, because it was really the creation of an entire diagnostic system and treatment system. We'll come back to this somewhere around week 11. The other is wind heat. The book associated with that is the Wen Bing. We don't have a single author for that, but it was probably a group of physicians. This was developed much later than the Shanhan Lun. Again, it's primarily an herbal text, and this created the 4-level model. 6 stages, 4 levels. We're also going to talk about this in week 11. If you do the herbal program, often these are offered, classes on these subjects are offered as electives after you finish the entire rest of the herbal program. These two books are two of like the foundational classical texts within Chinese medicine. And each of these charts the pathway from getting the common cold or the flu or an invasion in many different ways of either of these types of pathogens all the way to death in a patient, and all the different ways that it can move through the body and how to deal with them at all those different stages. This is the basic difference between the two. They often look pretty similar in the very beginning. One of the things you may start noticing as you go forward with Chinese medicine is some of the very early stage signs that you're getting sick. If when you get a cold, it tends to start off with an itchiness, dryness, or tickling in your throat. That means you're probably more prone to wind heat invasions. You're probably getting a wind heat. And if you start off by getting tightness in the back of your neck, it's probably more likely a wind cold. This is one of the reasons why you see acupuncturists wearing scarves all the time. It's an easy way to prevent to reduce the frequency of wind cold invasions. As for the other evils, they mostly, because they don't exist much by themselves anymore, they mostly become additions onto wind heat or wind cold. So wind cold, damp invasion is going to look like the common cold, plus a lot more obstruction, pressure, aching, bloating, mucus, distension showing up. So if one person's common cold is coughing, sneezing, shivers, a little bit feverish, you add in damp, it's also a headache where the person feels like there's a balloon that's been puffed up too much in their sinuses. If you're adding in dryness, then you tend to see this manifest mostly in the organs susceptible to dryness, lungs and the large intestine, which means it shows up on the skin a lot. And so this is catching a cold that results in dry, itchy skin. Often also a feeling of brittleness or fragility, which is something the metal phase tends towards. Coughing, constipation, also common. Toxicity, pus, odor, or stranger mental emotional things. Usually if you see toxicity showing up, we're referring to an MD at these stages. We're good at treating it, but it's not really in our scope of practice in the United States to be dealing with things that might be strange infectious diseases. And phlegm invasions, we'll talk a bit about phlegm in the future. We're going to spend a lot of time on phlegm actually because it's fascinating and not what it sounds like. Strokes, Bell's palsy, sudden paralysis, and most of the strange disorders are types of phlegm. So someone getting Bell's palsy, we usually call that wind phlegm invading the channels. It's usually something that happens like that. Person wakes up the next morning. The frequency with which people are exposed to strange weather conditions right before getting Bell's palsy, treated about half a dozen cases. All of them had something very strange happen in the few days before they got it. We see this as literally an external invasion from the environment. I'm going to get on a soapbox for a minute here. Summer heat is dumb. You're going to hear about this a bit, but it's just heat stroke. The type of heat stroke you only get when it's hot and really humid, and the humidity is high enough that your sweat doesn't evaporate, and therefore your sweating doesn't cool you down anymore. You get this in the South. You get this in Louisiana. I got this in Cyprus. It's not great. You just sweat constantly, you don't cool down, and you start overheating, and at the same time getting dehydrated. It's different from the type of heat stroke that you would be getting in, say, the Mojave Desert, where it's very dry, where your sweat is effectively cooling you, it just can't cool you fast enough. In this case, you just start leaking fluids. And it just doesn't happen that much anymore. And we mostly treat this through herbal medicine to generate fluids and drain heat. We'll talk about that later. That's the box in which pretty much all external disease fits. Obviously, there's a lot of complexity there. You can spend your entire life studying this subject, but you now know all of the terminology really to cover the basics of external disease. It starts off that simple. We generally don't care about it as much as internal disease. We doubly don't care about it as much as internal disease in the West, where a lot of the more severe presentations of external disease result in hospital referrals. We can do some great work here, but it's a hard thing to specialize in, let's put it that way. The basic idea for this is you want to have strong Wei Qi. The stronger your Wei Qi is, the less likely you are to get sick. If you're free of internal disease and have good internal balance, then your Wei Qi will be strong. So the best way to tonify your Wei Qi is to just have your system working well in general. Clean up all the areas that you have small problems. The question within Western medicine, the idea of like who gets sick and who doesn't. Like a bunch of people are exposed to the same virus. Why do some people get sick and others don't? We have kind of a vague concept of the immune system and the immune system response there. Within Chinese medicine, it's just a question of Wei Qi. And we have points and herbs that tonify Wei Qi. Stomach 36, one of our most popular points, is a good point for tonifying Wei Qi. And herbally, we often use astragalus root or Huang Qi to do so, in combination with other things. So I've spent some time working in Central America in areas where a bunch of people were getting sick. What do I do before I go there? I start building up my Wei Qi. If you know you're going to be, if I was working right now in some different world in hospitals treating a bunch of patients with COVID, I would be aggressively tonifying my Wei Qi every day at the expense of everything else if I had to. So that's the very basic framework of external disease. Don't worry, we're going to talk about it a bunch more. But ultimately, we only have these three sources of disease. There's a little argument about what's internal versus what's miscellaneous. We'll get to that. But these are the three sources. External, which means pathogens overcoming Wei Qi. Internal, which means pathogens arising due to lifestyle factors, which means emotions and habits that a person engages in. And then there's miscellaneous, which are acts of God, poisoning, dog bites, car crashes. And the reason that miscellaneous is a separate category is because there's nothing we can do preventatively about this. There's no real theory behind that. Something crazy, chaotic happens, and then all we can do is respond. The other two we can prepare in advance. We can make sure that people are in a good situation to be ready for it. And frankly, external and internal pathogens are relatively predictable, or external and internal sources of disease are relatively predictable. We can usually work well with those. The miscellaneous ones come out of nowhere. No matter what we do, if a person decides to eat a bunch of lead paint, we can't really stop that from becoming a problem. We might be able to treat it afterwards, but we can't really do much to prevent it. Lindsay has a question. You may have answered and I missed. Once you have an external pathogen move interior, is it still good to build up your Wei Qi? If you have a pathogenic invasion, can it get stuck inside if you build up your Wei Qi while it's inside? 100%, you can get things stuck inside of you if you build up your Wei Qi. The concept of pathogens stuck in latency or pathogens stuck within the body is something we're going to briefly touch on in this semester. It's a kind of more advanced concept. One of the 6 stages, we're going to talk about that. But yes, in general, when you are sick, you should not build up your Wei Qi. I like to go back to the metaphor of the city. If outside forces have invaded into your city, you probably shouldn't close the gates on them because you're going to get them back out through the same gates they came in through. This is one of the reasons why oftentimes we see a person starting to sweat, a person who's gotten sick and hasn't been sweating, someone who's caught a cold. When they start sweating, the disease tends to be resolving. How do you build up Wei Qi? You use acupuncture. How far do I want to go with this answer? We're near the end of the slide, so I can spend a minute on this. When you have strong Wei Qi and working in COVID-19 ER room, would you be presenting antibodies of the virus or no? I don't know. Maybe. It's not something I've, that's not a question I've ever found myself asking. Crossing between Western and Eastern medicine like that is a little hard to do, to get those sorts of answers. The answer is probably that it depends, but I don't know. Let me just spend a second here on how to tonify Wei Qi, and then we'll come to that next question. So this should look familiar. Right? Simplify this a little bit. This is the literal process for how you build Wei Qi. Right? The Wei Qi is comprised of Da Qi and Gu Qi. It's comprised of air and food. Now, that means that if you want to build Wei Qi, you've got to address every single part of this pathway. So You got to make sure that the person is breathing well and that they're eating well. Then you've got to make sure that their lungs are doing their job well, that while they're breathing well, that the actual exchange is happening correctly and that dachi is being produced. And you've got to make sure that their digestive system is operating properly and that guqi is being produced. The frequency with which people are eating very nutritious, heavy, like 10 types of supplement food, but they're doing it on a system that can't handle it and overburdening it and not producing guqi, it happens a lot. You got to make sure that both of these are, that there's no obstruction preventing these from moving up to the chest. There's zongqi and zhengqi, don't worry about that for now. And then you've got to make sure that this transformation is happening, which means you're bringing up some kidney qi usually. And then that should begin producing what you want. This is the reason why the main acupuncture point we have, stomach 36, for tonifying everything, because that's one of the strongest points we have for increasing the functionality of the spleen for digestion. That's why stomach 36 works well. That's true because it's a Hasi point and it's a Harori point. Because of both of these things, and it's an earth Harori point specifically, and it's a yang point. All of these things at the same time combine to have the strongest possible influence on increasing in the moment and in the short term, the ability for the spleen to digest better and produce more guqi. That's why stomach 36 works. Does that answer your question about how to tonify Wei Qi? So then the question just becomes, what are the things that provide this function? And that's what you're in school to learn. And stomach 36 is a good example. Okay. So if someone is sick, should they not focus on nutrition, points, herbs to building Wei Qi? How would you go about getting a pathogen out first with something like nutrition? Is there specific nutrition for someone currently sick versus after they're sick? So the first answer is it depends for all of those things. And now let me give you hopefully a better answer than that. If someone is sick, what type of sick? If it's an external invasion, then we want to make sure that we're not building up the wall too much and that we can still get things out. There are different schools of thought on this. We have different ways of treating disease that we're going to talk about next week. Sometimes we want to sweat the person. Sometimes we want them to defecate. Sometimes we want them to vomit. Sometimes we want to bleed the patient. We don't always use these we don't use a lot of vomiting anymore because culturally super inappropriate. But we have different ways of getting the disease out of the body. Depending on the technique we want to use to get the disease out, that's going to dictate where we want to tonify and strengthen. So if we want to get it back out through the pores, we probably don't want to build up the Wei Qi. But if we're worried about them getting more infections before we resolve, more invasions before we resolve this, it might be worth it to decide that that can stay inside of them while we prevent the rest of it. That's theoretical. In practice, I don't really know when I would do that. But in theory, that's how it could work. How would you go about getting a pathogen out first with something like nutrition? I hope you're in, Lindsay, I hope you're in the herbal program because nutrition and herbs are the same thing. Nutrition is just slower. The difference between something being an herb and something being food is how fast and how aggressive it changes your internal environment. That's it. Something like dandelion is halfway in between the two. It's both food and an herb. Is there specific nutrition for someone currently sick versus after they're sick? You could do a 2-year program on that. I've taught a nutrition class before. 1 semester is about enough time to get an overview, and I talk faster in that class. There are textbooks on this. Healing with Whole Foods is not a very good one. No one reads it, in my experience. But it's the one everyone buys, but no one reads it. And a lot of the information seems to be wrong. Lindsay, obviously specific things to incorporate nutritionally would be dependent on what you're sick with, but just generally speaking. It's hard to do generally speaking, because sometimes you do completely opposite things. But the basic answer is you want to make sure that they have sufficient qi in blood to maintain function and to do whatever is necessarily internally to provide that aspect of resolving the pathogen. And you also want to be using herbs and or food which move their body towards resolving the pathogen in the way you want to. So for example, if you're working with someone who has a wind cold invasion and they're not sweating and their pores are closed already because cold contracts, you might give them egg drop soup with a lot of heat in it to help them sweat. If someone's really deficient and burnt out from being sick for a long time with a lot of vomiting and diarrhea, we might use something like congee to slowly build them back up. Very dependent. And happy to answer, but that's about as good as I can do right now. I'm happy to take any other questions we've got, and then I've got a little reading I want to do for you guys, and then we are done for this week. Next week's quiz is basically just going to be going over what are the 6 evils, how do they combine. It's going over the last handful of slides. That's about it. And it's multiple choice. Any other questions?
I kind of have a question, and it might be a bigger tangent than what you're prepared for.
We'll
so
see what we can do.
That's fine, like whatever. I noticed like through the years, kind of, especially in any type of alternative modality to Western medicine, kind of this obsessive hang up, especially like in America, on food and how it's like the key to everything. But like you just said, you could pump the body full of healthy food or nutrition, whatever, like that's boosting it. But if there's something else going on, and that's kind of what I'm wondering, is that kind of the gray area that we're talking about here, that Chinese medicine maybe is catching something that maybe other things aren't? Because it's like when people tell me that the food is the key to everything, I'm like, well, I'm not really inclined to agree, especially like myself, my husband, a lot of people I know, even if you have a healthy diet, constantly coming across with like a new food allergy or a new thing this or that. And it's like, I'm just kind of confused by that whole obsession. So that's kind of what I'm getting at.
Sure. I think I can do, I'm going to do 5 minutes on this, but we could spend a semester on it. So short answer, what does food do in Chinese medicine? So it's going to produces qi, blood, fluids, yin, and yang, right? This is, all of this translates more or less as the nutritional aspects of food, right? This is all of supplementation within a normal way of thinking. There's more to it than just that, but that's kind of what we're talking about. Very often, people who don't need their blood tonified, like have healthy blood, but you know, it's healthy, more is better, I hear. So let's just keep tonifying this and producing more and more and more. And if you produce things you don't need and over tonify somebody, they get stagnant and things stop working well. So that's very common. In addition to producing these things, every food has a temperature. Every cooking method changes the temperature. Where the food is produced changes the temperature. How old the food is, how ripe it is, all of the quality aspects change this. And this goes from cold to cool to neutral to warm to hot. I'm going to have to breeze through some of this here, but here's an example. A person who's deficient, who needs all of this tonified and has a weak spleen and stomach, if the food is cold, they won't be able to get anything out of it. If a patient has a lot of heartburn, and is constantly hungry, not gnawing hunger, but ravenous, even when completely full, they're still hungry, tends to be a lot of heat. If they're constantly taking in hot food, it's going to produce problems. Tofu is very cold, for example. So I've encountered plenty of, I have no problem with veganism. Chinese medicine has a little bit of a problem with veganism. I have a lot of problems with the way most people are vegan. And a lot of them are very deficient in eating almost exclusively cold food, for example. In addition to both of these, every food and herb has a tropism. Another way of saying that is a directionality, or just a direction. So does it go up, down, in, out, or around? We're not really going to talk about around, but you should recognize these as the movements of each of the elements. All of these, in fact, both of these are related to the 5 phases or 5 elements. If either of these are imbalanced, especially if they're imbalanced heavily, this doesn't matter. All of these have to be balanced together, and we only ever talk about or care about this within a standard Western medical context, within a standard cultural context, because this stuff's not, you can't measure these in the same way. What you can do is figure these out based on how the food interacts with the person's system and what happens afterwards. So my general recommendation to people is, if you learn the theory well enough, then you can watch how your body interacts with the foods and you can modify your diet based on how it's responding. And there is no such thing as a correct diet, because every diet is out of balance, and you always want to be changing the ways in which it's out of balance as seasons change, as your age changes. No one should be eating the same diet they were eating 10 years ago. You probably shouldn't eat the same things in summer and winter if you're in an area where the temperatures change a lot. It's complicated. But all of the ideas are the same ideas we're going to talk about in Chinese medicine for points for everything. How's that for an answer?
Helpful. Thank you.
Good. So yes, food is central to everything. And it's been argued that the highest level practitioners of Chinese medicine are mostly using diet, but that doesn't mean that the way food is normally talked about has anything to do with that. And becoming obsessed about food is the surest way to have none of that work right. Okay. Let me just see if there's any other questions. And then I've got a little reading I want to do here. I'll share this screen too. Some more screen sharing. This is from a book called Mortal Lessons by Richard Seltzer, who was the chief of surgery at Yale back in the 60s and 70s. And I'm just going to, normally if we were in class, I'd have you guys read sections, but I think I'm just going to do that here. So according to him, true story. On the bulletin board in the front hall of the hospital where I work, there appeared an announcement. Yeshi Dondon, it read, will make rounds at 6 o'clock on the morning of June 10. The particulars were then given, followed by a notation. Yeshi Dondon is personal physician to the Dalai Lama. I am not so leathery a skeptic that I would knowingly ignore an emissary from the gods. Not only might such sang-froid be inimical to one's earthly well-being, it could take care of eternity as well. Thus, on the morning of June 10, I joined the clutch of whitecoats waiting in the small conference room adjacent to the ward selected for the rounds. The air in the room is heavy with ill-concealed dubiety and suspicion of bamboozlement. At precisely 6 o'clock, he materializes, a short, golden, barrelly man, dressed in a sleeveless robe of saffron and maroon. His scalp is shaven, and the only visible hair is a scanty black line above each hooded eye. He bows in greeting while his young interpreter makes the introduction. Yeshi Dondon, we are told, will examine a patient selected by a member of the staff. The diagnosis is as unknown to Yeshi Dondon as it is to us. The examination of the patient will take place in our presence, after which we will reconvene in the conference room, where Yeshi Dondon will discuss the case. We are further informed that for the past 2 hours, Yashidanden has purified himself by bathing, fasting, and prayer. I, having breakfasted well, performed only the most desultory of ablutions, and given no thought at all to my soul, glanced furtively at my fellows. Suddenly we seem a soiled, uncouth lot. The patient had been awakened early and told that she was to be examined by a foreign doctor, and had been asked to produce a fresh specimen of urine. So when we enter her room, the woman shows no surprise. She has long ago taken on that mixture of compliance and resignation that is the face of chronic illness. This was to be but another in an endless series of tests and examinations. Yashidanden steps to the bedside while the rest stand apart, watching. For a long time he gazes at the woman, favoring no part of her body with his eyes, but seeming to fix his glance at a place just above her supine form. I too study her. No physical sign nor obvious symptom gives a clue to the nature of her disease. At last he takes her hand, raising it in both of his own. Now he bends over the bed in a kind of crouching stance, his head drawn down in the collar of his robe. His eyes are closed as he feels for her pulse. In a moment he has found the spot, and for the next half hour he remains thus, suspended above the patient like some exotic golden bird with folded wings, holding the pulse of the woman beneath his fingers, cradling her hand in his. All the power of the man seems to have been drawn down into this one purpose. It is palpation of the pulse raised to the state of ritual. From the foot of the bed where I stand, it is as though he and the patient have entered a special place of isolation, of apartness, about which a vacancy hovers and across which no violation is possible. After a moment, the woman rests back upon her pillow. From time to time, she raises her head to look at the strange figure above her, then sinks back once more. I cannot see their hands joined in a correspondence that is exclusive, intimate, his fingers receiving the voice of her sick body through the rhythm and throb she offers at her wrist. All at once I am envious, not of him, not of Yashidanden for his gift of beauty and holiness, but of her. I want to be held like that, touched so, received. And I know that I, who have palpated 100,000 pulses, have not felt a single one. At last Yashidanden straightens, gently places the woman's hand upon the bed and steps back. The interpreter produces a small wooden bowl and 2 sticks. Yashidanden pours a portion of the urine specimen into the bowl and proceeds to whip the liquid with the 2 sticks. This he does for several minutes until a foam is raised. Then, bowing above the bowl, he inhales the odor 3 times. He sets down the bowl and turns to leave. All this while, he has not uttered a single word. As he nears the door, the woman raises her head and calls out to him, in voice at once urgent and serene. "Thank you, doctor," she says, and touches with her other hand the place he had held on her wrist, as though to recapture something that had visited there. Yashidanden turns back for a moment to gaze at her, then steps into the corridor, rounds her at an end. We are seated once more in the conference room. Yashidanden speaks now for the first time in soft Tibetan sounds that I have never heard before. He has barely begun when the young interpreter begins to translate, the 2 voices continuing in tandem, a bilingual fugue, the one chasing the other. It is like the chanting of monks. He speaks of winds coursing through the body of the woman, currents that break against their barriers, eddying. These vortices are in her blood, he says, the last spendings of an imperfect heart. Between the chambers of her heart, long, long before she was born, a wind had come and blown open a deep gate that must never be opened. Through it charged the full waters of her river, as the mountain stream cascades in the springtime, battering, knocking loose the land, and flooding her breath. Thus he speaks and is silent. May we now have the diagnosis, a professor asks. The host of these rounds, the man who knows, answers. Congenital heart disease, he says. Interventricular septal defect, a hole in the wall between the left and right chambers of the heart, with resultant heart failure. A gateway in the heart, I think, that must not be opened. Through it charged the full waters that flood her breath. So, here then is the doctor listening to the sounds of the body, to which the rest of us are deaf. He is more than doctor, he is priest. And I don't read that story because I think that that's something that I do, or something that necessarily the people here will be doing, but it's something worth striving for. And Tibetan medicine isn't Chinese medicine, but there's a lot of overlap. And yeah, hopefully that's something that can be a little inspiring for the next week.